brief reintroduction to what the study's all about, to remind people what we're doing and kind of contextualize all of the findings that we will be talking about next. So this study is really focused on understanding postpartum depression, and the reason why we focused on postpartum depression is because it is a really important health issue that affects many women and their families. But research in the area of postpartum depression has focused almost exclusively on heterosexual women. And Abby and I had been doing work both independently and together that had shown that sexual minority women also at times struggle with mental health concerns during the transition to parenthood. So we decided to work together to look at what women's experiences were of their mental health during the transition to parenthood. And so this study, to our knowledge, is the first one that's looked at the impact of minority stress, which I'll talk about in a minute, on mental health of lesbian, bisexual, and queer women during the first postpartum year, and also looking at that in comparison to the mental health of heterosexual women. So one of the things that's really unique about this project is that we're looking at different subgroups of sexual minority women. So in our previous research, we found that women's sexual history and their partner's gender were important in understanding their current mental health risks in the transition to parenthood. So in this study, we've actually divided our sexual minority participants into two groups. One group that we're calling our visible sexual minority women, so these are women who are currently partnered with women. And then one group that we're calling our invisible sexual minority women. And these are women who either identify as bisexual or queer or have had same-sex relationships in the past 5 years, but they're currently partnered with a man. So because they're male partnered, their sexual minority identity or history is invisible to people around them, and particularly to their healthcare providers. So that's why we have called them invisible sexual minority women. And in our pilot study that Abby and I did before we started this project, we found that it was this group, the invisible sexual minority women, who were particularly at risk for postpartum depression. So that's why you'll find that a lot of the pieces of analysis that we're working on now are quite focused on this particular group. So we used two different frameworks in this project to help us think about how we were going to ask these research questions. The first one is the ecological framework, or in public health we sometimes talk about it as a social ecological model. And this framework gives us a way of thinking about health outcomes that happen across different levels. So in this study we focused on understanding the determinants of health at an individual level. So things like an individual's personality or aspects of their personal history. At the meso level, which is interpersonal relationships like with family or with healthcare providers or other important people in their lives, and also factors at the macro level, so things like the national legal climate. So we're really interested in understanding factors that could influence well-being at all of those levels. And then the second conceptual framework that we use is called the minority stress framework. And this is a framework that helps us understand why it is that sexual minority people in particular have high rates of mental health problems. And this framework postulates that the reason for that is that sexual minority people experience the same everyday stresses as heterosexual people, but in addition to those stresses also experience unique stresses that have to do with being a minority person. So experiences of discrimination in particular, and stress associated with a stigmatized social identity. So in this study, we're definitely very interested in and attentive to experiences of discrimination and social exclusion as we think important contributors to mental health. So using those frameworks, the research questions that we were asking in this study were, first of all, whether sexual minority women have higher risk for depression at 6 to 8 weeks postpartum compared to heterosexual women. And then within that, do invisible sexual minority women in particular have higher risk for depression than our other two groups, the visible sexual minority women and the heterosexual women? And then our second research question was looking at minority stress. So among sexual minority women, do minority stress processes explain the relationship between minority status and depression at 6 to 8 weeks postpartum? So those were the questions that we were asking in this project. So, in terms of how we actually did the research, it was a multi site study through here in Toronto and also in Boston. And we had 16 midwifery and obstetrical clinics that participated in recruiting our participants. So, altogether, we had about 100 women who completed surveys online that included questions about their pregnancy, social support, stressful experiences, experiences of discrimination, and their mental health. We were also interested in understanding the experiences of our invisible sexual minority women in more detail, so we used qualitative interviews with participants in this group, and we interviewed each of them 4 times over the course of pregnancy and the first postpartum year. So that's the study in a nutshell, and so what we will do now is go through and tell you a little bit about some of the preliminary results that we are finding in relation to our research questions and in relation to other questions that have emerged from the data as we've gone along.